can wind up tissues a lot more by being on the scap instead of just being on the general shoulder complex. Okay?
And remember, we could do that same, the PIR, he did a little stronger resistance, more of a contract relax. We can do a gentle contraction, let the patient relax, and let the shoulder find the new barrier, okay?
So
You can get into your use your breathing,
so you would breathe
even
in.
eye movement, but don't
And
worry
the-
about that.
And what I like to use is, so let's say they're in this position, I'll just tell them to gently shrug up into my hand, shrug your left shoulder, and then relax, and I follow it down. So instead of cranking on the neck, I might move the shoulder a little bit more than trying to tweak the neck, especially if they're a little sore through there.
You'll really, early on, have a tendency to crank on the C-spine, so be careful of that.
Use your scapula.
You're not going to bother them too much. You can get pretty firm on the shoulder. Okay? Let's just try that.
Press your shoulder, maybe just grab onto something. And as I side bend away, upper track, hand on the head, look towards the armpit, levator scap. And to get the scalenes, I'll bring them into that upper trap position, and I'll have them look towards the ceiling, so their left eye is looking up, and then I'll teach them how to chin tuck. 3 stretches really, really quick, and you can just, patients like it because it feels instantaneous relief for them. Positions are-
Levator. Sorry, let me get in here. Sorry, Caitlin.
Wing it. I like using my thenars. It's a little more comfortable. But a lot of times I'll get both of my hands on the scapula. So what you want to do is, the motion is retraction, depression, and upward rotation. And you can see her head actually comes right up with that. So my hands are kind of doing this sort of motion. Imagine the scapula turning up this way.
Yeah, visualize that superior angle of the scapula. It's moving away.
Right here. I'm pushing it down, I'm retracting it, and I'm rotating it upward. If you look at her head, depress, retract, sorry, I don't have a good head. Depress, retract, rotate, her head pops right up, and so gravity is just pulling on that levator. If you want to be really mean, if your patient thinks, it feels good, you could actually use that elbow to get a little bit more. Don't love it, especially if they're really cute. If you want to tweak this and get a little posterior scaling, have your patient look down towards the table. Feels a little different? There you go. That's it. Depress, retract, upwardly rotate.
That should tweak the upper trap, or the elevator too, though.
Right.
Right?
It is levator.
Looking, you said scalene in there.
Yeah,
So
posterior scalene.
bilateral flexion and rotation away,
Right.
right? Okay.
Does that feel pretty good?
Kind of.